So I had my psychiatrist appointment this afternoon, and I think it went very well. This is the first time that I met with a psychiatrist, and I had a very nice first impression with him, and I thought that he was quite professional as well. So, yeah, I thought all went pretty well. And in his judgment, he said that he believes that I actually, I do. He does not think that I have schizophrenia, but he thinks that I have bipolar disorder, or something like it, like some type of mood disorder. But he said specifically bipolar disorder. So, yeah, after talking with him for a while and telling him, my whole history with, mental health and hospitalizations and all the therapists and psychologists and the psychiatrists that I've seen in the past, and yeah, so he said in his judgment and based on like what other symptoms I was presenting with at the intake and with discussing with him, that he said that he believes that I actually have bipolar disorder. So yeah, and but it's not like set in stone, but that's just what he was getting at. And yeah, so he wrote me a prescription for Vraylar, and it's 1.5 milligrams every morning with some food to try and offset the negative side effects. But he said the side effects should only last a few days at most, and if I have any, and then I should basically adjust to the new medication. And he wants to see me back in 2 weeks' time, and yeah, then I guess we'll discuss how things are going, if I have any more side effects or anything to discuss, and I guess everything I'm going through, and et cetera, and yeah, basically, I guess, yeah, maybe increase the dosage, because I did a bit of research on Vraylar myself, after getting the prescription, and yeah, the maintenance dose for bipolar would be about 3 to 6 milligrams daily. Let me see if I can change the contrast a little bit. I feel like I'm a bit too bright right now. Okay, I think that's good. Turn it down a little bit. Yeah, so the yeah, that's more like the maintenance dose, but I guess he just kind of wants to see how I react to this, and the schizophrenia maintenance dose would be anywhere from 1.5 to 6 milligrams, I think. So they both have like the same maximum, but I think for schizophrenia the maintenance dose can be lower. Yeah, so anyways, I'm going to be taking that starting tomorrow morning, and I guess I'll post updates on how everything is going with that, and if I have any symptoms. And yeah, it's an atypical antipsychotic, and yeah, and this one actually does have the chance of causing akathisia, which I was actually going to do a video, I'll probably do it soon, talking about Abilify and the akathisia that I got on that. It was really bad, and honestly, it's the worst antipsychotic symptom that I have experienced from it's the worst one. And it's just, I don't even know how to describe it other than like your skin is crawling, but I don't think that does it justice. It's like extreme restlessness, and it's just like agitation, but you feel like your whole body is tingly, like your nervous system is like inflamed or something. It's a really bad feeling, and that persists for a while. I was taking the medications, and actually when I was taking first one, well, anyway, I'll talk about the Abilify in another time, but yeah, so I was from what I understand, there's a lesser chance, it's less likely to get akathisia with a Vraylar than it is for Abilify. But my psychiatrist, he told me that if I have any of the real negative side effects, to call them, but things like headache and nausea and a little bit of like diarrhea and stuff, that's pretty normal and almost to be expected. And should get over that in a few days if you already have any side effects. And then from the independent research I did, like, some people were saying that actually the onset of side effects for Vraylar may actually be later. So I don't know, we'll just figure it out. I'm not obsessing over it or anything, but yeah, he did tell me that he doesn't want to give me anything for the OCD right now, because that would include an SSRI, and that could really be bad if I have bipolar. So yeah, I'm not going to be on that right now, which I'm kind of glad, because actually I reacted poorly to SSRIs in the past. So that would actually, I don't know, that would kind of make sense. Yeah, so, but he said, I asked if there's any chance that the antipsychotic could help with, like, the OCD, and he said it's possible, like, indirectly. So yeah, I'm hoping that, I mean, that's like best case scenario, that this, I have minimal side effects and I get over them quickly, and I have, it treats, whether I have schizophrenia or bipolar, it helps with that. And yeah, but also in addition, it would be good if it, helped with some of the OCD stuff as well. But I have to go to therapy for that, because honestly, really the best way to treat OCD is, like, the medication can help, like, release the anxiety, but it's like mostly, like, the medication's not going to really cure the OCD. You're going to have to do the therapy work and do the behavioral work and thought work. So yeah, it's just like I've been putting that off. Yeah, I thought I'd do this video outside because I was doing the other videos inside a lot, and I thought I'd just change scenery. It got too dark before I could really, film it properly. And honestly, there's not many places to, like, go and, like, set up the camera and, sit down or stand. And I mean, so many of the places I would record before are now, like, all iced up, and it's real dangerous. It's like the top of the snow is real icy. This spot isn't that bad, but I did find a better spot, but it's really dark right now, so I'll probably just have to do it tomorrow if I want to do it. And also, there might be more people around. I was trying to look for a more secluded spot. So yeah, anyways, that's the update for right now. I'm going to start taking it tomorrow morning. Yeah, take it with a bit of food to try and offset some of the symptoms, but I'm just going to keep posting about it, and I guess I'll make a post, like, maybe a day after I take it or a little bit after I take it. But I'm really hoping I don't get the akathisia. From what I understand in the research, it shows that you're more likely to get akathisia, about like twice as likely to get akathisia from Vraylar as if you had a schizophrenia. So I guess part of the, depending on what type of symptoms that you have, and you, as a result of the medication, I guess they can help them, help the psychiatrist, determine exactly what your diagnosis is as well. So I guess we'll see, but I'm just really hoping that I don't have akathisia. It's really bad. Like, anything but that, like, even just eating a lot of food, like having an increased appetite or high blood sugar, I mean, that's way better compared to the akathisia. But yeah, and even the restlessness, or not the restlessness, but the, like, lethargy that you have, even that's better in sleeping a lot than the akathisia. The akathisia is quite bad. So yeah, I guess we'll just have to wait and see. I'm kind of repeating myself here, but yeah, I have a good feeling about the psychiatrist and the meeting. But yeah, this new diagnosis, seemingly new diagnosis, is, I don't know if it's thrown me for a loop. I guess I'm not super surprised, but it just does. Yeah, it is just kind of, like, confusing, and it's like some things make more sense, but some things don't make as much sense. I don't know if you can have schizophrenia and bipolar at the same time. I mean, that seems kind of rare, but yeah, anyways, maybe I just have, like, bipolar and was, like, experiencing psychosis. Just had these recurring psychotic episodes. But the thing is that a lot of the delusions that I had, they were not mood dependent, as I mentioned before, and I actually I was gonna say, like, some of them, they would quiet down, but like it wasn't always like I had an episode and only had those like delusional thoughts. Like they persist like all the time, and like even now some of them persist, and like I guess just the general high psychological salience. Maybe I'm just a paranoid individual, or I don't know if it's like something with my personality or what exactly, but yeah, anyways, I'm just hoping it doesn't make the OCD symptoms worse. Honestly, that's something I just thought of too. If it makes the OCD symptoms worse, that's going to be a nightmare as well. That'll probably be up there with the akathisia. But yeah, I'm going to pick up the prescription soon. And yeah, I'm going to set out, like, going to get a bunch of healthier foods to eat and not like all this junk foods if it does cause like high blood sugar, and I have like an increase of appetite. I don't want to gain a whole bunch of weight, and I'm going to be trying to work out too during that time. I mean, I just try to work out in general, but yeah, I really don't want to gain all that weight again, because when I was on Zyprexa, also known as olanzapine, I was like gaining a whole lot of weight. But yeah, the psychiatrist told me if I have all that lethargy and I'm sleeping a whole lot and have these more negative side effects like tremors and I don't know if tardive or how do you say it, something dyskinesia, tardive dyskinesia is caused by, or Vraylar can cause it or what, but he just said if there was more of the serious side effects to contact him. But yeah, basically yeah, he said just if it's the more mild side effects, just kind of ride it out. And yeah, but if it's like tremors and all kinds of crazy stuff, like, yeah, just to contact him. I guess if it's a serious emergency, something else. But I think that's about all I have right now. If I have more that I want to mention or say, I'll probably talk more about a new diagnosis soon, but I just wanted to give an update to the psychiatry appointment that I had. Yeah, and that's about it. But I'm hopeful. I finally got this appointment. I'm in contact with a psychiatrist again, and I'm hopeful about things, but I guess you would say cautiously optimistic. I'm just right now hoping that once I start taking this medication, I don't have the negative side effects, as I said. But yeah, and I guess we'll see in a couple weeks. Hoping all goes well. And so, yeah, anyways, thanks for watching, and peace out. Peace out. See ya. Hi, so today is February 11th, almost the 12th. It's about 11 p.m. right now as I'm recording this video, and I still haven't taken the medication yet. And the reason why I haven't taken the medication yet is because after I got the prescription filled, I went to the pharmacy, and basically there was a debacle with the insurance, but there was a really high deductible, and yeah, I was going to have to pay for the drug out of pocket until the deductible was paid off, or is paid off, and it was really high, as you know, can be the case with a lot of these brand name pharmaceuticals and antipsychotic drugs. And as far as I'm aware, Vraylar is going to continue to be very expensive for me, even after I pay off the deductible. So I was thinking that I have to contact the nurse practitioner, the psychiatric nurse practitioner, in order to, change the prescription to something more affordable, because it was going to be like $270 a month for the Vraylar, as opposed to just about $8 a month for something like generic Zyprexa, also known as olanzapine or risperidone or risperidol, whatever. So yeah, I did not have the drug yet, but the psychiatrist told me that I can come to the office in person and he would give me free samples for it, basically, and a card that would basically pay off the deductible. So yeah, right now I just have samples and I'm going to try it, that for now. And he told me to just start it tomorrow morning. So I have enough for 2 weeks right now, and the appointment is a little less than 2 weeks. I think it's on the, I want to say 23rd, maybe? Yeah, the 23rd of February. So it's the 11th, almost 12th. Yeah, that's what's going to happen. I'm just going to be taking it, and then I'll meet with him on the 23rd, and I guess we'll discuss stuff from there. But yeah, he says if it comes down to it, then he could probably just give me more of the samples as well, and I guess we'll just figure it out from there. But yeah, I'm kind of glad that I was able to get this though, because I did gain a lot of weight with the Zyprexa. You know, you get high LDL cholesterol. I think it lowers your HDL as well. You know, higher triglycerides, high blood sugar, insulin resistance, weight gain, a lot of bad side effects. The somnolence, the lethargy, sleeping like 12 to 16 hours every day. I might have had sexual side effects. I can't really remember, honestly. Honestly, at that point in my life, I was basically asexual. So I don't think that the Vraylar has as many negative side effects or as high instances of them, or incidences, I should say. But yeah, I feel pretty good about it. That it seems like it performs a lot better than placebo in the trials, like for schizophrenia and also bipolar 1 mania. It only did a little bit better or marginally better than the placebo for bipolar depression, but it still did better. So I mean, that's good. And honestly, I've been in quite the slump. I've been pretty depressed recently for the most part. So I guess hopefully, yeah, it's supposed to help with that as well. It's also given for adjunctive therapy in major depressive disorder. I don't have that though. So yeah, anyways, just here's a sample right there. Yeah, so just 1.5 milligrams a day right now, and see how I do. But yeah, I'm just going to be starting it tomorrow, hoping all goes well. And I don't know if there's that much else to mention right now. Don't think there's all that much else to say that I didn't already say in my other video that you watched just before this, the other clip from a couple days ago, where I just said, yeah, I'm hopefully cautiously optimistic, and I just hope that everything goes okay and I don't have that many side effects, or at least any of the serious side effects. Hoping I don't get akathisia or anything like that, and definitely hoping it kind of restores a lot of the things that I've lost in my life due to this condition that I'm in and my poor mental health. So I have heard bad things about it messing with your sleep, and my sleep is already an absolute disaster as it is. So I don't really even know if it matters, but hope it doesn't make it any worse, at least. But I'm just hoping I don't get that side effect. Yeah, I'm just rambling on. I don't think there's all that much else to say. Yeah, I'm going to try and sleep more than a few hours tonight. I already slept like 1 to 2 hours, and then I got up, couldn't really go back to bed. I'm not feeling too great, just in general with my mood. So, yeah, we'll see. I'm gonna be documenting this on a regular basis, and hey, maybe over the next few months I'll be feeling a lot better and it'll be able to help me. I don't know. So, yeah. Anyways, that's about all I have to say right now, and peace out. See ya.